It's been a good month for Africa's scientists and public health institutions. Working together, we understand they have described and analysed over 100,000 genomes and managed to characterise SARS-CoV-2 variants in real time. This report arising from the work involving 300 authors from the continent and even further abroad. If you're very interested in this, of course, you can go look for it in the journal. It's featured in Science Today. Or let's speak to somebody who hopefully can make sense of all of it for me. Is Professor Tulio De Oliveira, much smarter, of course, than I am, from KZN's Research and Innovation Sequencing Platform. Morning to you, Prof. Good to have you back on eNCA. Why is this important? Because COVID-19 in the early days, of course, we were all chasing our tails a little bit. It's only been a short 3 years, and now we're sequencing in real time. Congratulations. Why is this so important, Prof?
Okay. Good morning to you and to your listeners first. Yeah, it is very important for three main reasons. Yeah, the first, it is not the first time that we are sequencing real time, and South Africa and Africa became leads of genomic surveillance and identification of variants. But now we have this technology and we are beginning to use that in real time to deal with our other epidemics, HIV, tuberculosis, malaria. Yeah. So that was a big investment, not only on funding, massive investment from both our government, but also international donors, but also a large investment on training and capacity building. And our teams, both in Durban and Stellenbosch University, we have received over 200 African fellows that they come for weeks to our labs, so that when they go back to the country, they can produce also genomic data in real time.
But it's all about the early warning capacity around this as well. I mean, it's fascinating to hear, Prof, you talk about HIV, TB, malaria from an African and continental perspective. What would this achieve going forward? Help me understand medically for those dealing with HIV, TB, malaria, etc. How does this move the treatment forward?
Okay, yeah, thank you. Very good question. Yeah, so for HIV and TB, it's all related to drug resistant. So what it means that we have to make sure that the patient is in the right regimen. And then when the patient starts failing, so what you do, you sequence, either you do the genome of the virus or the bacteria, and then you can use that to give the precise medicine to the patient, which we call, for example, precision medicine. And that's very, very well used for HIV and TB. For malaria, we have a new vaccine that's beginning to be rolled in Africa, and we also have resistance to some of the therapies. So we have to make sure that the vaccine is effective and that also the therapies are effective to treat malaria.
I would imagine then, Prof, because you are quite critical of how the international nations were treating South Africa and Africa during those early stages of lockdown and the various stages of COVID-19 and all the variants as well. There's an irony here, I'm sure you'll agree with me, Prof, that all of this was researched and funded and developed in Africa while the rest of the world was marginalizing the continent and South Africa. There's an irony there, isn't there?
Yeah, yes. The biggest irony is that in Africa, in most of the regions in Africa, we had 5 waves of infections. And we calculated that 4 and potentially even the 50th wave were all caused from introductions from outside, mostly from Europe and North America, and some from Asia. So that's the big irony that South Africa and Africa were some of the best regions in the world to be able to identify variants, and we suffer a severe travel ban, economic disruption, which may just be associated with discrimination, and most of the variants were introduced from outside, especially on East, West, and North Africa that have very strong contact with North America and Europe, But another important fact is that what it was also shown is that travel bans are completely ineffective. And I don't believe that that's going to be a tool that other countries will use against South Africa and Africa in the near future.
It's wonderful to see this kind of research coming out of Africa when the rest of the world now looks to us to help them with this genome sequencing as well. Prof, I can't let you go without just getting your thoughts, and I'm sure you would have seen it. The US President Joe Biden saying, and I quote, "The pandemic is over." What was your reaction, and what is your reaction when you hear the US President saying something like the COVID-19 pandemic is over? Last question to you.
Yes, so Dr. Tedros, the Director General from the World Health Organization, say very similar words last week. Yeah. And we are in very strong contact with Dr. Tedros. He came to visit us in South Africa as we opened the mRNA hub and our labs. Yeah. And that's followed a week later by the President of the United States. Yeah. So what we think as a scientist, we think that the worst of the pandemic, it's over. But more than ever, it's very important that we continue this important work of genomic surveillance, because if something else comes, not only another variant, but another virus, we want to identify that very quick, so it causes less disruptance as the COVID pandemic.
So you don't think it's dangerous? It's too early for the president of the US to say the pandemic is over? You don't think it sends the wrong message?
I think that the worst of the pandemic is over, yeah, and that's because very large population immunity. If we want to really be safe, the right thing now would get the ones that are in time for a booster, to get a booster, especially before the winter season in the Northern Hemisphere. That's when a lot of the respiratory virus transmit, yeah. But in general, I think the really worst of the pandemic, it is over.
Oh, thank heavens. That's good news to hear it from someone as credible as you. Prof, thank you very much. As always, Professor Tulio De Oliveira, still got to be safe, still got to go for the boosters.